Welcome to the NP POW Videocast, a space where we are going to talk to nurse practitioner experts who are going to share their POWs, or pearls of wisdom, on an array of healthcare topics. I am your host, Dr. Julia Rogers, a certified nurse practitioner, and today we are very honored to have Dr. Jamie Newland with us to discuss the world of writing, publishing, and reviewing. Thanks for joining us today, Dr. Newland.
Oh, you're welcome. It's my pleasure.
It's really an honor to tap into your years of knowledge and expertise regarding publishing. Can you tell us a little bit about yourself and the work that you have done in writing, publishing, reviewing, and as the current editor of the Nurse Practitioner Journal?
I'm a family nurse practitioner, and I had a very good mentor who was on the editorial board, actually, of the Nurse Practitioner. And when she decided her time was up, she said, give it a try, Anyway, I started out with the American Journal of Nursing. They had a special series on advanced practice and nurse practitioner protocols, because at the time there weren't a lot of published protocols for nurse practitioners. And so every month for about four or 5 years, ran a series, and I was working at Pace University, where we actually wrote our own protocols. And so we used those to publish in American Journal of Nursing. And that's how I got started, really a long time ago in 1994. And I was on the editorial advisory board for many years, and then joined the editorial board of the Nurse Practitioner. And when I became the editor-in-chief of the Nurse Practitioner, then I was removed, of course, from AJN. But during that time, I gained a lot of experience writing and editing. And I really have to thank my 11th and 12th grade English teacher. That's where I say I learned to write. We had small classes, and she was really good. And I would say that's really where I learned to write.
We all need that one good mentor, for sure.
Yes, definitely. And I've been editor-in-chief now for 18 and a half years, which is a long time.
Yes, kudos, congratulations.
Yes, but I've enjoyed all of it, and I think the journal has changed during my leadership. And of course, I'm going to say that it's excellent.
It is. So thank you for all of the hard work that you do on the journal. We all know that the publishing arena can be really intimidating, especially the first time that you are writing for submission to a journal. And there are many guidelines to follow, and many can differ from journal to journal. So I am wondering, from your perspective, what are some pearls of wisdom, or what we call POWs on the videocast, when a nurse practitioner would like to start the process for writing for publication?
Well, the first thing is to believe in yourself. Have confidence. Anyone can be a writer, an author. You have a lot of knowledge that you can share, that people are interested in hearing about. Your experiences also can be interesting. And if you have a particular area of expertise, those who are in that area want to hear from you. But everyone has something to offer, different levels, whatever, but, and just being confident that you have something to share. And if you need assistance in moving forward with that, you seek those who have been writing, even starting by looking at presentations. If you've presented, turn that presentation into an article, a manuscript, But everyone has a voice. And if you don't let your voice be heard, the wonderful things that you're doing will never be known, and no one can replicate or, actually learn from you. And so it's really a good idea to write. And writing also gets your name out there, can help with your professional development. But primarily, you do have an expertise to share. And so don't be afraid. You do have the ability, you have the skill set. A little mentoring may be necessary, but you can do it.
Yes, you mentioned some of the benefits for writing, really getting your voice out there, everyone has their own little area of expertise as a nurse practitioner. And so having all of those voices heard really makes an impact within the nurse practitioner world so that we can all learn more. Are there any other benefits for writing for publication?
Well, the thing is, nurses and nurse practitioners, we do so much, but the world doesn't know what we do. And
Very
the only
true.
way someone is going to know what you actually do is write about it, because people outside of nursing will be interested in hearing what you have to say, even about your a routine day. But it really is to also elevate nursing and to advocate for, the concerns we have in nursing, also for all the joys that we have. And we know that the relationship with the patient is one of the most satisfying aspects of what we do. And letting patients know that, the public know that, that nurses, NPs are great. And what we do really is to have a voice. Again,
Yes.
it's having a voice.
I agree. So the more information we can get out there, hopefully more will think about writing. When they're thinking about writing, what are some of the steps in writing a manuscript, and how can one determine when that manuscript then is ready to submit for publication?
Well, I always recommend that you start with writing about something a topic that you're comfortable with. Start there. And you can also start, a manuscript doesn't have to always be a big paper. My first, what I call manuscript, was a letter to the editor of HAN. I was a nursing student, and there was an article on women in Nigeria about healthcare. And I happened to be in my public health rotation then, and I had a family from Nigeria that I visited in their home, and she just had a baby. And so I took that article and I asked her if the things that were in that article were true. And she confirmed they were. And I just wanted to let the editor know that, what they were publishing was real life, and
Mhm.
my letter was published. And so that was my first. You can start very small, like a
Mhm.
newsletter, a local newspaper or something. You don't have to aim initially at that big journal, because there are many different places that you can have your voice heard.
I
But
agree. Sometimes we only see the very big picture and we don't
yes,
think about starting smaller and kind of
starting
moving your
small.
way up.
Yes, yes. But we have what we call the five W's of writing, which is why, where, what, who, and when. And of course, the what is deciding what you're going to write about. And you can ask your friends or colleagues what they consider an area that you have a strength in, or where they've seen you sort of shine, or where they come to you all the time asking about information. And I've explained why we should write. And of course, who, that's you, should write. Where, again, I just spoke a brief about the different places you can write, you know. And another place you can write is like a book chapter. When, of course, the time is now. We all are masters at procrastinating. And especially if it's something that we may fear a little bit, like writing, because I'm sure most writing assignments you've had have been mandatory, what we call, academic or scientific writing. Uh, has not been something you've said, oh, let me just do this. They've been sort of mandatory.
Mhm.
Well, now is your opportunity to have pleasure in writing. Writing should be something that brings you joy, satisfaction, that you enjoy doing. Sure, it's tedious, but the outcome, when you see something that you've written published, before you know it, you're going to be distributing all over the world, every relative you have, every colleague you have, because it is an achievement. And as I said, you are able to do it. The time is now. You are the person to do it. Pick a topic and start.
And honestly, it's one of those things that the more you keep doing it and engaging yourself in it, the better you keep becoming. So there's always room for improvement. I'm sure that you see that even at the level that you're at, that each time you just keep improving.
Yes, yes, it's true. Doing something over and over again makes you better. And even things that I write are edited by someone else. And so you're never at a point where you're just going to write and for publication and it's perfect. There's no such thing as a perfect draft. And that's one thing that we sometimes fall into, is wanting every word, every sentence, the paragraph to be perfect. And you can spend hours on one paragraph. Just put the words on paper. You can always go back and revise them. That's part of writing, is continually revising to make it better. And
True,
so
that's great advice.
yes, just start. And another thing with writing is that you don't have to write something from the beginning to the end. If you feel the middle part is stronger, write that and then go back to the beginning or the end. And when you finish everything, you'll put it together, because of course organization is important. Starting out with an outline may be helpful also. And as you go through the steps, share it with those that you trust to give you an honest answer about what you've put on the paper. And put your armadillo skin on. You're going to need it. And just
that's the
remember
only
that,
way to learn, is to
yes,
have honest feedback.
honest feedback, and honest, constructive feedback is not personal. It's to help you improve, and look at it that way. No one is attacking you. They're
That's
just
a great
looking
thing
at
to
the
put in the back of
words.
your mind, because you're right.
Yes,
It's not an attack. They
yes,
actually are just trying to guide you to
just
become
trying.
better.
Yes, to become better. And that's the whole thing with writing, revising, and feedback, revising, feedback, revising. You'll learn very much what revisions are.
Yeah.
My students used to, they had a joke, who had the most revisions to make on a paper they had to submit. A paper that, I was the one who was, of course, grading it, you know, and the competition was tough.
I'm sure they appreciate it, though, all these years
Yes,
later.
yes, yes. As faculty member also, I, of course, mentor students with writing. And I always say that students or anyone will only perform to the level of expectation.
Well
And
said.
and
Mhm.
so if expectations are high, you will meet them. You'll be surprised at how well you can write with practice and repeated practice.
I agree. I think that goes for anything, but definitely for writing. I
Yes.
agree. Well, we know that there's lots of journals out there to choose from. Do you have any advice for our listeners in how they can determine which journal to submit to for their manuscript?
Well, one thing that helps with writing is reading. You need to read different journals. That will help you decide what might be the best fit for your particular manuscript, for your topic and your manuscript, because you need to target the readership of a particular journal. And if it's a very specialized topic, you may want to consider a specialty journal versus a more general. But really, it's read. And if you see something in the articles that are published that resonates with you, that sort of sounds like what you want to say or the way you want to say it, then that might be the journal for you. And you can always query an editor. If they permit that, all journal editors do not take queries, but usually in the instructions for the author or on the website somewhere, they will let you know whether or not they do accept queries. About your topic, give as much information as you can about what you want to write about and ask if they are interested. And if you receive a yes, I'm interested, go for it. Don't procrastinate. Go for it then, while the editor can remember you.
Yeah, exactly.
Yes, yes. But really reading the journals. And if you are, it doesn't matter if you're a clinician, educator, administrator, whatever, I always suggest that you read outside of your area. That means outside of your profession. And two journals, magazines that I read often are National Geographic and the Smithsonian. And I've written many of my editorials based on articles written there. The more you read, the more you will understand writing. And it will also help you organize thoughts, to see how others write. And also when you write, have someone who doesn't know a thing about what you're writing read it. They are
That's the
reading it
best way to
just
know
to
they can
see.
understand.
Yes, they are reading it just to see if it's actually readable.
Exactly.
Does it flow? Organization, does it make sense? They don't need to know the content, but does it make sense with what's on the paper? Yeah.
Well, and I find if you read a lot of other authors, the nice thing is you can kind of pull what you like from each to
Yes.
create your own style and what makes
Yes.
sense to you when you're writing.
Yes, that's true. Very true.
What types of articles can be submitted, and then what are the criteria for those manuscripts?
Well, for the nurse practitioner, of course, as Julia said, journals vary. They're very different. But for our journal, we do accept what we call feature articles, which is maybe on a particular topic like hypertension or something like that. Case studies, again, which would be about a particular patient of interest, perhaps a diagnosis that was a little tricky, or a special treatment, or unexpected outcome, or whatever, something that would be out of the ordinary with that particular a patient. Of course, original research articles we encourage, and we do have a list on our website of all the different types of articles that we publish, with the word counts and suggestions for the number of references and for restrictions on number of figures or tables that you can have. The important thing with looking at the type of article you want to write is to make sure that you read the author guidelines and instructions completely, because following those is very important. There are some journal editors that, if they're not followed to the T, will reject the manuscript immediately, won't even look at it. And so it's really following those instructions. Once you decide on the type of article, really following the instructions. And also journals use different styles, whether it's APA, AMA, whatever it might be. But that really is a plus when a manuscript is submitted and with initial review by the internal editorial team, guidelines have been followed, that lets the editor know that that author has at least reviewed the journal, read articles in the journal, and really wants to be published in that journal.
Yes, I'm glad you brought all of that up because I think misnomer in nursing is that every journal will want APA, but that
Yes.
is actually the opposite. I find that most journals do something other than APA. Yes.
Yes, yes. Well, the thing with APA takes a lot of space because you have to write all those names.
Yes, exactly.
And I think it's better to use that space with words, content,
Yes.
versus listing a lot of authors. But
agreed.
Yes.
I know that waiting for a response can certainly evoke a lot of anxiety. So, in order to alleviate some of that, can you explain the process once a manuscript has been submitted? What kind of process does it go through?
Well, it's first reviewed, and of course, I'm speaking to this journal. Other editors or processes may be a little different, but there are some common rules. Is that someone will determine whether or not the manuscript is targeting the audience for the journal. If I get a manuscript comes in and it's a research study on nurses in ICU, nothing about advanced practice, that manuscript will be rejected immediately. Doesn't mean that it's bad. It just simply means it's not for my particular journal. And so that's the first determination. And sometimes editor will also think about the amount of work a manuscript might need to go through the entire process, the resources that might be needed, and is it likely that the outcome is going to be a positive and acceptance. Sometimes manuscripts are sent back to the author for revision before peer review. That would be the case with something that may need some more work. But once it's determined to go to peer review, it is sent to peer reviewers, and our journal does do blind peer review. The author doesn't know who's reviewing it, and the reviewer doesn't know who the author is.
Nice.
But something that's happening a lot more now is actually reviews where the author and reviewer know the names. They're open reviews, and reviews are published, and that's something that, each individual reviewer would decide if they wanted their review to be open. But after it goes to peer reviewers, it's returned, and then the editor decides if revisions are needed. Rarely is something, a manuscript accepted without revision. Very rarely. It can happen, but it's sent back to the author for revision. And usually they're given a time period. And then after revisions, they resubmit. And then the editor will make the decision of whether to accept or whether further revisions are needed or whether to reject. A manuscript can be rejected after revisions. So, and again, for various reasons. And so the thing is to just, if you are asked to revise, revise. And as timely as you can. The time period from your first submission to a final decision, it can vary, and it depends a lot on how responsive peer reviewers are. Finding someone with the expertise to review it, and again, also how responsive the author is in resubmitting with revisions. For the nurse practitioner, our goal is really to have manuscripts from from submission to final decision, provided that's not a reject immediately. That decision comes very quickly. But 3 to 6 months is reasonable.
Yes.
And I think that's sort of common among most journals. Yeah.
Well, such great advice so far, Dr. Newland, so thank you. Let's move on to becoming a journal peer reviewer, since you really kind of ended with that. Let's just start with the basics. When you talk about a peer reviewer, what does that mean, and how can someone actually become a peer reviewer?
A peer reviewer is someone with expertise in a particular topic which they attest to. And when someone reviews, they should focus on the content of the manuscript, not all of the grammar, spelling, all of those editorial type things, but the content. Is the content current? Is it evidence-based? Is there anything missing, major omission from that manuscript on that topic? Or are there any statements that are not accurate in the content? Those are the main things that a reviewer should concentrate on and make comments. Editors like comments, not just a yes, accept, or minor revision or major revision without comments. Authors need feedback, and feedback that is as specific as possible. You can actually point out a page number, a line number, or something of whatever the comment is about. So specific, constructive criticism. We don't want to attack anyone. And there are guidelines, writing guidelines that with suggestions of how to write constructive feedback. And of course, peer reviews that are timely. Reminders are sent out, and with our journal, I always give a reviewer 3 weeks to review.
Nice.
Which I think is sufficient time, and but mainly the peer reviewer concentrate on content. And to become a peer reviewer, some journals are always asking for peer reviewers. Well, the interested person needs to submit their CV or resume to the editor or whoever the person is that will be making the decision about becoming a peer reviewer. And I know when I review the CVs and resumes, I look to see if the person, of course, has some practice experience. And if they are an educator, they probably have been mentoring students with papers, but I also look to see about presentations or publications, but that doesn't exclude someone from being a reviewer if they haven't presented professionally or published, because practical experience is actually the best teacher for most things. And I also like to look at how involved they are beyond their regular position. What organizations they might belong to, community activities, or anything that gives. The more well-rounded a person is, the broader their view will be when looking at a manuscript, and perhaps they have skills they don't even realize they have, for review. And so and then sometimes when they submit, we may ask them if they'd be interested in also signing up to be a peer reviewer. So there are many ways, but if you're interested at all, respond to one of the many invitations for peer review. Yes.
Because that's how we have a better journal, right? Is to have those peer reviews. And so then the authors can become better at writers, and we get just increased quality of manuscripts coming in.
Definitely.
How many manuscripts a year would you say a reviewer evaluates?
Well, I try not to do more than 3 a year, but it depends on their the areas they've indicated where their expertise is.
Mhm.
And very common things like hypertension or something, you may get a lot of reviews. But if you're very restricted, let's say pediatric neurology, you might
Yes.
not receive so many. But I try not to overburden the reviewers, and I personally don't ask anyone to review within a 3-month period. Not closer than 3 months. If if you've done a review, I will not be asking you again for at least 3 months.
That's part of what I've heard from individuals saying why they didn't want to become a peer reviewer. They thought you would have to do one a month or possibly every other month.
Oh,
And so I think that'll be great for our listeners to know that it's
yes,
kind of spread out throughout the year. It's not just
yes,
back-to-back
yes,
reviews.
yes, yes. I try to because everyone is busy, and peer reviewing is usually a volunteer activity. And it's
Mhm.
also a way for you to give back professionally.
I
And
agree.
so think of it as helping the profession. And if you're
Mhm.
in a very specialized area, think of it as really advocating for your area and promoting awareness. Yes.
I found being a peer reviewer also helps you as an author because you
Yes.
realize, again, just different styles, different way of
Hmm.
presenting material.
Yes. Yes. Because
So
peer
in your,
reviewing is reading, and reading
yes,
helps
you're
writing.
right. In your last few minutes, can you please provide us one or two POWs or pearls of wisdom for our listeners that actually helped you grow as a writer, a reviewer, and an editor?
Well, there are authors, and if someone who's written a lot or that you may work with or have an affiliation with, if they invite you to write with them,
Mhm.
do it. That is a very good way to start writing, is not being a solo writer. Write on a team. It's very helpful because everyone will have different strengths and you will learn from each other. And you typically will be able to have a broader content
Mhm.
within a manuscript. Uh, don't give up. There are times when writing can
Yeah.
be very difficult. We call it writer's block. You know, however you decide you're going to write, you will establish a pattern for writing. You know, and whether you schedule, like an hour on your calendar once a
Mhm.
week or whatever, or 10 minutes every day to write at least a sentence or whatever, but don't give up. And if you find yourself just uh, blocked,
Mhm.
step away. You can always go back to it, but sometimes you need to step away and then come back refreshed.
Mhm. Just take a minute
And
to breathe.
yes, yes, yes,
Mhm.
you do, because everything is rambling in your head and it doesn't make sense, and you're just fed up with it. So step away and then come back and you'll say, "Oh, okay,
Yes, it
not so
becomes all
bad."
clearer.
Yes, yes, uh, not so bad. And if you do receive rejection, sometimes it is the wrong journal.
Mhm.
Look around and see. Sometimes, especially at the advanced practice level, you need to perhaps go into more depth in
Mhm.
your discussions or whatever. And if you are submitting something like a quality improvement project,
Mhm.
uh, there are really guidelines for different types of manuscripts. There are guidelines. And just like if it's quality improvement, stay within quality improvement terminology and not research terminology,
Mhm.
you know. But one of the biggest thing is don't give up, but also have people read what you write, you know.
Mhm.
Have that adult child or
Mhm.
your spouse or anyone, colleague, just have them read what you write before you submit it anywhere.
Yes, because I
Yeah.
find that sometimes your eyes overlook things because you've looked
Yes.
at it a
You've looked
million
at it.
times, and
Yes.
others can just pick out that one
Pick up.
thing because their
Yes.
eyes are fresh.
Yes. Yes. Yes.
Well, I hope our listeners have more insight on writing for publication and becoming more involved as an author and as a reviewer. And it all just starts with an idea and you sitting down and making the time to write. You provided
Yes.
such wonderful guidance today for our listeners, Dr. Newland. And I thank you again for sharing your time, knowledge, and your POWs with us on the NP
Thank you.
POW Videocast. I also just want to thank all of our viewers and listeners and hope that you come back to hear more pearls of wisdom from our NP experts in the future. Until then, this is Julia Rogers wishing you joy today and every day.